welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Lisa Yeh. She is a psychiatrist and she wrote the Kevin MD article, Autism Spectrum Disorder and the Masks We Wear. Lisa, welcome to the show.
Thank you so much, Kevin. I really appreciate being able to talk about the op-ed that I wrote. So just for people to kind of know a little bit about who I am a child adolescent psychiatrist, and I've been working for almost 30 years in this business. I started off, in my training with my general adult psychiatry over at Harbor UCLA over in California, and I followed up with a child adolescent psychiatry fellowship also at Harbor UCLA. I started off, being trained on this thing called the DSM, right? So the Diagnostic Statistical Manual that we all use for psychiatry. It was the DSM-3. And so my journey about understanding autism kind of started off with that initial training. And really what that was is, I remember the exact description of someone with autism was that they would rock back and forth and say, cheese, cheese. And that's what I got trained on. So over the years, not only has the medical community understood more about autism, I have been able to understand a lot more about autism. And part of that journey was that I have been kind of working in academic settings. So my first place was Children's Memorial Hospital, which is now called Lurie's. And then I've kind of moved on to another academic setting called Illinois Masonic. And currently, in 2018, I moved over to Rush University Medical Center. Also, these are all in Chicago programs. And everything that I was doing was really in this kind of neurodevelopmental area and kind of seeing patients in many ways. The biggest thing for me was that the Rush program, that I'm actually the medical director of our autism program there, is a lifespan clinic. And so instead of just focusing really on child, I also see a lot of adults. And so my oldest are in their 70s, so it just is this really big span. So I can see how things that I was doing and promoting as a child psychiatrist really kind of impacts later on in adulthood. And that's kind of where I've come to, being able to understand the real diversity that we're seeing in our patients and understanding more about how they developed and really what those lifetime needs are going to be for them. And so that's kind of what put me to where I am and why I wrote the article that I did. Right, because it helped with that.
Now, before we talk about that article, just walk us through a typical day and tell me about some of the typical cases that you see in the people that you meet in your clinic.
All right, so like I was saying, it is a lifespan clinic. So I see kids as, early as a couple of months old. So we do a lot of kind of earlier intervention types of things where we look at the initial diagnosing, of a lot of our kids, are looking at these kind of developmental delays that they have. And so I do some psychiatric evaluations for that to kind of make some recommendations. But for other kids, that they may come at school age, or even a lot of our adults that we see that I may be working on evaluating of whether they have autism or not. And oftentimes our adults are ones who have had, relatively, productive lives. They've, graduated from high school, has some sort of a job, or did secondary education and then got a job. They have relationships, they have significant others, or gotten married and have children. And they've always kind of felt like there is something off, that there's something different. And those are the ones that kind of come in later on to try to get that diagnosis. So we do a lot of the evaluations for our older adults, that can't figure out why their life isn't the way that they anticipated it would be, and why they're not relating in the way that they see other people that they care about relating. I do a lot of training as well, because it's really important that we have more doctors be able to understand how to work with this population. And so not only am I working with the autism population and people with neurodevelopmental disabilities, we work on helping those specialty kind of clinics. So I did form one for LGBTQ issues, and we're working on trauma types of things as well, and developing more help with the resources and things like that. So the way that we run at Rush is that we are equal branches of clinical research and outreach. So it is really kind of my job is trying to not only do the diagnosing of it and helping with treatment planning and looking at medications and doing training, but we're also like trying to do cutting edge research and helping to move it forward, and also as much resources as we can to help, the community. So it's really given me a very more complete look of things of where I'm at right now.
All right, let's transition into the Kevin MD article that you wrote. It's titled Autism Spectrum Disorder and the Masks We Wear. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, sure. So it is, as I was kind of saying, that my concepts of what's going on in the autism world has really kind of developed over the course of time, and just kind of seeing this lifespan type of a thing. So what this article really was I was really being struck by how much, as a child psychiatrist, we work towards social skills and helping people develop them and to be able to work and live and have friends in the non-autism world. But the impact of that, and why I wrote that and what this article is about the struggles that people with autism, in particular the ones that we don't necessarily recognize easily, that have autism. So they speak well, they have good strong cognitive levels, and they're able to do a lot of things, and that sometimes we just don't recognize that they have autism, and we anticipate and expect them to be like anyone without autism. And even though I've been pushing and hoping and helping them to learn these skills, they still have these struggles, and that's what I call the masks, that they try to hide that they have autism, that they're an autistic person, and they try to fit into the non-autistic world. And the result of that is that there is this feeling of not fitting in still, that they can't do what we told them they're supposed to be able to do. And in the end, that people who don't feel like they can connect feel like there's something is wrong with them. And this has caused a lot of depression in the autism world that we are not recognizing. Part of the reason is because of that social communication issues that people with autism have. And so we do see a high amount of depression that they can't tell us in the same ways that we would anticipate, saying, I'm sad, or I feel, I have anhedonia, all of those types of things that we ask about depression. They can't always tell us that. And so we miss it. And we make them go through their life thinking that they're supposed to be in this non-autism world like a non-autistic person, but that they're not. And the suicide rate for autism is 2%. The general population suicide rate is 0.5 or 0.6. So it's significantly impacting what they're doing. And so for my article, what I was talking about is that we need to start recognizing that it's not just that we're training people to help them to socialize in a non-autistic world, that it is really important for us to start to recognize the difficulties that they're having, and that it is important for people that don't have autism to come to a place to them as well. It's not good enough for us to just work at people with autism coming to the non-autistic world. It is really important, I think, for people who don't have autism to start to think about the people that they've been thinking of, not necessarily knowing that they have autism, and treating them differently and anticipating that they should be able to understand what we're saying. And that's kind of really the gist of what I was trying to get to.
Can you share a story or a case study of someone with autism but with no overt symptoms, and some of the difficulties they face in connecting with society that really illustrates your point?
Yeah, so recently I had a person that came in and had friends through, grade school and high school, and was in college, and about to graduate from college, and really kind of looking for a job, but they were still kind of struggling. The pandemic kind of caused a lot of anxiety and difficulties, and the communications that were happening through these kinds of Zoom or whatever, type of video platform that was out there, were a little bit difficult for this person to be able to connect well and to be able to describe things as they used to be able to do. And so was telling somebody at school just how difficult it was. And so sometimes one of the things that people do when they have autism is that they describe things visually. because they can kind of see them in pictures. So instead of saying, oh, my professor was just, really hard on me and too critical and it made me feel really bad, the person kind of described burning and this and that. I mean, it sounded like something horrific almost, but it was to really give a good picture about that depth of feeling that the person had, and not that they wanted anyone to burn, that they wanted anything bad to happen to anybody. And so it was recommended that you go to therapy, right? And unfortunately, the clinician was not an autism specialist. And they have to screen for suicidality, homicidality, anything like that. And I got a call that they wanted to hospitalize this person, that there's all these kinds of things. And so I talked to them about them, like, well, what happened? Last time I spoke, there wasn't any kind of danger to self, danger to others. And the person said to me, oh yeah, we were having this great conversation with my new therapist. And then she started to kind of talk and talk and talk and talk. And she said, blah, 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 hurt, blah, 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 this, blah, blah, blah. I have no idea what she said. So I said, okay. So the thing is that one of the things that we know about autism is that people with autism are less likely to ask clarifying questions and more likely to pretend they understood something and just agree. And that's exactly what he did. So instead of the clinician saying, what do you mean by that? Can you explain that to me? What are those thoughts by it? They just said hospital, right? And got into really big trouble for this person, right? And that's one of the things, is that we misunderstand things. We expect that they understand what we're saying, and that what they're saying, we take it, we assume we understand what they're actually saying to us. And instead of being able to be helpful, really was very traumatic, because hospitalization for a lot of people who don't understand why they're being hospitalized, or even if they do understand it, can be a traumatic experience. And we see that often with people who lose their jobs because of it, or they lost a relationship, and or their significant other is telling them, why can't you respond like I want you to respond, when they can't. And I think you can see it in many times where I see people just responding to someone who just doesn't quite understand in a very negative way, that the immediate reaction is negative instead of, hey, let me figure out what's going on.
Well, I think part of it is, of course, recognizing the symptoms and signs. And one of the things that you mentioned is that people with this proverbial high-functioning autism, they typically don't ask clarifying questions. What other signs should we be on the lookout for?
Well, I would have to say that sometimes when we're seeing people and we expect them to be able to see the bigger picture of things, that abstract thinking, so that you give them a little bit of information and they're supposed to be able to kind of expand it in a way, that sometimes that may be a real difficult thing for some people with autism, that ability to fully abstract the way that we think about. So if someone is not quite getting it, and their IQ can be fantastic and they can be really smart, but that ability to problem solve, that ability to abstract may be not as well developed. And so if you're seeing someone who's really not getting it, step back and see, why is it that they're not getting it? Maybe there's something that is interfering with that ability for them to get it. Or sometimes the things that we see is that they're avoiding, right? So sensory issues, I kind of mentioned that in my article. Sensory issues is a really big issue for a lot of people, and that it could be the lights in the office, it could be the sounds and the noises. Sometimes they're so sensitive that even when we're speaking in normal voice, they feel like we're yelling at them, and then they seem to get defensive. And if they say things like that, stop yelling at me or something, and it's like, I'm not doing that. It may be because they have really these sensory sensitivities. Or if you see that they just getting too close to you, right? That's another thing, that they need that kind of connection type of a thing sometimes with their sensory issues, and they don't have the appropriate social boundaries. You can think about, I wonder, maybe there's something going on with that, or they really are really forceful when they, interact with you physically or things like that. That may be because of the sensory things that are going on. So, there are these types of oddities, the bluntness, the kind of sensory types of things may give us clues that maybe we're missing that person might have autism, and we need to just take a step back and kind of look at those patterns that they're doing. And maybe it is an issue for them, and we may be able to kind of find a different way to be able to approach.
We're talking to Lisa Yeh. She's a psychiatrist, and she wrote the Kevin MD article, Autism Spectrum Disorder and the Masks We Wear. Lisa, you mentioned a few of these tips already. So if we recognize that someone that we're talking to has autism or high functioning autism, what are some of the highest yield ways that we can do to improve our interactions with them?
Well, I definitely think, making sure that they understand what we're talking about. If you're feeling like you're giving instructions to somebody or you're saying something and they just don't seem to be getting it, ask those clarifying questions. Say, did you understand that? Would it be okay if you just repeated that back to me? Because if they're not going to ask that, if they're not going to check in with you about that, it is a good idea for us to be able to do that. And sometimes what I'll do is if they say no, because they might not understand my question when I ask them if they understood it, I'll sometimes just restate it later on just to make sure that they're getting it, and then recheck in with them. And so sometimes, people feel, well, I already checked, so why do I have to check again? There's a processing about it. And so the rechecking is an okay thing to be able to do. Just make sure we're all on the same page. Let's just, summarize, that type of a thing can be really helpful. If you're noticing that people are like having some sensory issues, like they kind of try to avoid lights, or they're thinking you're speaking too loudly to them, you can even ask them, hey, does this bother you? What can we do? And you can ask, what can be helpful for them, and they may be able to let you know about that. That recognition that they may be having a sensory issue can really go a long way for people to be able to feel more accepted, and it's okay. I mean, I think that's really one of the things, is that they need to feel okay that their symptoms can be accepted, right? Because there's a lot of things we try to do to help for sensory or to help for these things, but they're not 100% working. So they're still going to have some amount of difficulty with those types of things.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, first of all, I'd like to just say that I'm not a fan of high functioning the terminology, right? Because I do have people with lower cognitive abilities, and they have a little job of sorting or something, and they're super happy, they're functioning the way that they want to function, right? So it doesn't quite tell us anything about the person when we call them high functioning. And I do have a lot of my patients who have told me that it feels dismissive to them of their struggle. And so first of all, I would like to say that let's try to avoid that type of a thing and look at the person individually about where they are and the needs that they have for them. And then the other part is to just start to be more aware. I think, for someone like me who I see autism all day long, every day, it's easier for me to be able to pick things out and wonder about whether someone has autism or not. But I think for people who don't do that, just when we're starting to struggle with somebody, maybe take a step back and just see, what are those things? Is it a social communication part? Is it something that might be potentially sensory? And taking that step back may help us to be able to feel like we can be able to work with them or have a relationship with. And that goes a long way, I think, in helping out their world, that they feel that they are more accepted, that they don't have to always be, that behind that mask, is kind of what I was kind of talking about. And I think it's just good for us in any way to take a step back sometimes when we're having difficulties with someone, and to just rethink our approach and how we're interacting with them.
Lisa, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you so much for having me. It was a pleasure to be able to meet you.